Hello, everyone, and welcome to our next CME Palooza session. Let me bring up the slides for everyone to see. This is our Better, Smarter, Faster. We have the Technology, Trends, and Medical Publishing session, sponsored by Academy for Continued Healthcare Learning and Prova Education. Our moderator today is going to be Karen Roy. My slides are advancing on their own. Moderator, Karen Roy, CEO and co-founder of Infograph Ed. But before I turn things over to Karen, of course, let us thank all of our sponsors for CME Palooza. Our gold sponsors, Daiichi Sankyo, MedLearning Group, and PER. Our silver sponsors, ACHL, Academic CME, Antidote Education Company, Catamount Medical Education, and DKP Med. Hippocrates CME, Helio CME, Medscape Education, Integrity CE, Platform Q Health Education, Prova Education, RedMed Ed, Vindico Medical Education, and our bronze sponsors, Answers in CME, XDev, Bonum Continuing Education, Creative Educational Concepts, CMEology, Excalibur Medical Education, Global Education Group, Infograph Ed, MedIQ, PACE, Paradigm Medical Communications, Postgraduate Institute for Medicine, PriMed, PVI, RMEI Medical Education, and Right Medicine. Also, a big thanks to Telem Health for sponsoring our CME Palooza Steptacular Challenge. That was last week. For those of you who did not participate, you're missing out on a CME Palooza t-shirt, just saying. Okay, 3 ways that you can ask questions for CME Palooza. I'll be monitoring all of those. You can use the CME Outfitters text line, 267-6660-CME. You can tweet your question using the CME Palooza hashtag. And you can use the YouTube chat feature. If you're watching on our website, just click on the little watch on YouTube icon on the left-hand corner, bottom left-hand corner, and then you can use the chat function embedded there. We will be using Poll Everywhere, our ARS system, for a couple of questions, so make sure you're ready there. Thank you to Broadcast Beat Studios for sponsoring the ARS. You can either use the app, plugging in CME Palooza 005, or you can just use your web browser, and the URL is pollev.com, CME Palooza 005. Last thing from me. Opinions, discussions, and or conclusions expressed are those of our panelists and do not represent an endorsement by or a position of their employer, its parent company, or affiliates. So with that, I will turn things over to Karen.
Thanks, Derek, and thanks for having us. I'm going to start our lunchtime session today with some introductions. So my name is Karen Roy. I am CEO and co-founder of Infograph Ed. We are a boutique agency working in the healthcare communication space, providing visual communication services to various stakeholders. I am delighted today to be joined by Mark Riado from the Research Post. Mark and I actually worked together in past life. Mark, if you'd like to introduce yourself to the CME Palooza audience.
Sure. Thanks, Karen. Glad to be here. I'm Mark Riado. I'm the founder and president of the Research Post, which is a peer-reviewed publishing channel built on a visual presentation format.
Great. Thank you. And a new contact for me is Renee Walker. Renee works at Thomas Jefferson University, and I am fascinated by her job title and what she's working on. Welcome, Renee, if you'd like to introduce yourself.
Sure. Thanks, Karen. Hi, everybody. My name is Renee Walker, and as Karen mentioned, I am Associate Professor of Visual Communication Design at Thomas Jefferson University. Another role I have at Thomas Jefferson University is I also teach in a new grad program focused on health communication design, and really glad to be here. Thanks.
That's great. And we'll make sure to share the details of that program at the end of the session. So jumping in, if we can go to our first slide, please, Derek. Hopefully I'm not the oldest person involved with CME Palooza. I think Renee may have had to Google the $6 Million Man and Steve Austin. the reason why we've used this as a playful connection for this session is that I saw some blog posts recently, and they were kind of proposing how much would the $6 million man have cost today, and kind of looking at the production quality. It's like, okay, TV production from 50 years ago in that show, utilizing technology from 50 years ago, and the $6 million budget from 50 years ago. And around the same time, I saw an article on reviewing medical publishing and what had changed over 50 years. And the authors in that had been somewhat critical of the lack of change, quite frankly, in primarily manuscript development, citing that there was more of a change in terms of transparency and disclosures and ethics and compliance, but not really a lot of innovation on how we write manuscripts. Now, we're going to talk a little bit beyond manuscripts today with Mark, but that was really the genesis for this discussion, sort of how far have we come, where are we going, how can we prepare ourselves as stakeholders in this space. So next slide, please, Derek. So just to kind of level set everybody, what is the connection between the CME audience and medical publishing? So of course we are not, it's not our day jobs sort of writing or developing manuscripts for publications. However, we do rely on publications as a primary source for content in CME, among others. So we're interested in how timely it is, the content that we're pulling down, how up to date we are remaining, so that we can use that content in programs for our learners. But also CME providers more and more are being challenged with showing the value of what we are doing in the CME enterprise, publishing both needs assessments that can be useful for various stakeholders and outcomes reports. So did the education intervention work? What can we learn from that from a methodology standpoint, but also how are we changing the face of medicine or care practice, for example? So that's the context we're thinking of here. And obviously we'll be focusing on more as we move through on what you need to be aware of if you're working on publications for yourselves. So next slide, please. Now, I wanted to just include this as well, because this is a statistic that we hear a lot, that there is a 17-year time lag from translational research to practice, so to incorporating new innovations into clinical care. And that is a terribly long time. How much of that was a question sort of posed to me, was sort of how much of that is related to getting information out there, getting information in a way that people can consume easily, that they have the context for their practice in order to incorporate it into practice. So we're going to talk a little bit about the time lag in the publications part of that journey with Mark in a moment or so. But before we get into that, we have a couple of polling questions. So the first one up here is, we'd like to hear from the audience. Do you have experience in developing manuscripts for submission to medical or educational journals? So we have 80 no, just dropping down. So the majority no, some thinking, and about a third where we are right now. So about half saying no, the other maybe or have some experience. Thank you, Derek. The second question we have for you is, and try and answer this even if you haven't developed a manuscript, what are your perceived challenges? And if you do have the experience, what challenges did you find or do you find with the development of publications related to CE? And you can select all that apply here. We have adherence to guidelines and standards, the time and cost for your staff to work on the manuscript, the writing skills, cost of submissions, journal fees, things like that, or selection of the appropriate journal. So we've got a spread there as expected. Not surprised to see that the time and the cost taken for staff to write a manuscript can be one of the more common challenges. I'm actually glad to see that adherence to guidelines and standards also features, because it's something that I don't hear us talking about a lot in the CME community. So I've actually asked Mark to address that in his presentation to us as well this afternoon. So we can jump straight into inviting Mark. So Mark and I worked side by side for a number of years when I was leading the CME group at Cephalon, or a member of the CME group there for a long time. Mark was heading up our publications efforts in a number of our large franchise areas. And so why I have never worked personally directly in publications, I was publications adjacent for a long time, and learned a lot from Mark about the work, the diligence, the effort that goes into bringing clinical trials data in particular through the manuscript process. So Mark, thank you for joining us today.
Yeah, thanks, Karen, for the introduction again. And Derek, if you want to flip on to the next slide, it'll kind of pick up where we're talking about from the timing perspective to get data published. And this matches my experience of, well over 20 years doing medical publications on the pharmaceutical industry side. And it got me thinking about, is there a way that we could get information out sooner, which, jumping ahead got me to the research post as a need for this. But this is data from 2018, so not too old. It's analysis of over 300 studies published in 6 leading journals: JAMA, New England Journal, JAMA Internal Medicine, BMJ, Lancet, and Annals. And basically what they found is the median time from when a study got completed till when it got published was 15 months, about 15 months. And, so well over a year. And this was supposed to be for the best data, the most important data, the data that impacts, public health, going to these kind of journals. And with this being the median time at 15 months, it means half took longer, right? And, what this analysis found is that government funded studies took on average 6 months longer than an industry sponsored study. But the important part of this as well is not that there's an opportunity here to do this better. Almost 20% of studies took over 2 years to get published. And what that meant is that by the time the data were published and they looked at the median time of the clinical trial enrollment, they looked at the median timeline for the study. And when they mapped that out to when the manuscript got published, the data could be 3 years old just from that clinical trial. And it speaks to, it speaks back to what Karen was talking about, that 17-year lag from, translational research to getting something, into clinicians' hands and into practice. But 3 years of that could just be from one clinical trial until you get until you get a manuscript published. So I looked at this and said, maybe, there's a way to do this faster in this day and age of how fast information moves. Medical research generally does not, right? And it seems that that's an important area and an opportunity where maybe we can shave some time off the end of that, and that would ultimately impact patient care, right? Which is, the goal of, what I'm trying to accomplish with the research post. And, the same thing, what we're trying to accomplish through a continuing medical education effort is to educate clinicians on the newest advances, and then they can apply them into their clinical practice, ultimately to help patient care, right? And so I think we, the publishing area and the medical education slides ultimately look at the end game of, how do we get information to help patients, and how do we do that better, right? And I'm trying to incorporate some concepts that I'm not expert in terms of like adult learning concepts. And, we're going to speak a lot about visual initiatives with Renee and how to present data. But, I think we can all understand that people like visuals better than words. And, Karen spoke about publications, and someone now analyzing publications, they haven't really changed in 50 years in terms of manuscripts. Well, actually, they haven't changed in hundreds of years. I've seen different stories on when the first medical journal was, and there's some people who say they're 300 years old, and essentially they haven't changed. And in this day and age, with all the technology that we have available to the title of this session, we have a lot of technology available to us today to maybe do this better and smarter and faster, to tie into the Steve Austin theme. So.
And definitely disrupting the traditional medical publishing business. I mean, having things not only taking that long to get a manuscript through the submission process, but things living behind paid firewalls obviously close off access to a large proportion of the audience as well. So open access has become something you hear people talking about more now.
Yeah, there's a lot of push towards open access, and almost every journal will offer that as an option, right? And there's very few journals that do not do it that way, where you still have to be a subscriber. Many journals have gone to just online only, right? That they're not printing a copy, that a printed copy is not showing up on your desk. And, I saw journals starting to do this 10, 15 years ago, where they were getting away from the printed copy. It was one journal I worked in a therapeutic area where if you could subscribe, but if you wanted a printed copy, that your subscription was going to be a couple $100 more, because they would print it for you and they would send it to you, but it's a cost. And in this day and age, people read stuff on their phones and they want to share it with their friends and their colleagues, and they're not, photocopying articles and putting them in the folder anymore to use. So the dynamic of how we communicate has changed dramatically, and journals have made changes in that regard. But the foundational manuscript of how we communicate medical research and scientific research, that really hasn't changed all that much at all. And I think there's an opportunity for us to do this better. I know within the CME programs, my limited exposure to them directly, they've gotten, visual and using technology and satellite broadcasts and videos and streaming and all these other tools that are available to educate and inform. And that hasn't really happened so much on the core journal side.
Right. Yeah,
right.
Absolutely.
Yeah.
So one thing we touched on there, and some of the poll responses kind of showed a lack of confidence with the standards and the sort of the guidelines around it. I mean, as CME professionals, we're very aware of the ACCME standards for professionals and adhering to that and developing particularly commercially sponsored, supported CME. So what should we be aware of when we're moving to the publication world with our data?
Yeah, there's a lot of information out there. Derek, you can flip to the next slide. So there's a lot of guidelines out there and guidances. I just wanted to kind of focus on two and touch on some other checklists that are out there and available as well. So probably the most important guideline to understand is the ICMJE authorship recommendation. So ICMJE is the International Committee of Medical Journal Editors. They've put together a set of recommendations that have been revised now a few times over the years. And, the point of the guidelines is to instill best practices and ethical reporting of medical research and other content that goes into medical journal. It's designed for authors. Most journals embrace, these concepts. And if you look at their authorship submission requirements, they'll say we follow ICMJE recommendations. And there are a number of elements behind that in terms of reporting, disclosure, of conflicts of interest, transparency, protecting research participants, and those kind of criteria as well. But the ones I wanted to kind of focus on here is just kind of the authorship recommendations. And in my experience, this is always the big negotiation around a manuscript. Who's an author, right? Who gets to be an author? Who meets the criteria for authorship? A lot of people will lobby for this, and there are different reasons why different people want to be authors, from the academic perspective, from the industry perspective, and others, from other stakeholders within a research project. In my world, it was all, the question often came up: does the medical writer contracted to produce this meet the authorship requirements? And generally the answer is no, right? So there's four kind of steps to the meeting the authorship criteria. The first one is substantial contribution to the conception or design of the work, or the acquisition, analysis, or interpretation of the data for the work, and that they have to draft the work or revise it critically for important content, final approval of the version to be published, and agreement to be accountable for all aspects of the work. And that doesn't mean that you have to be an expert on statistics or something, but it basically means that if you're an author, that if someone asks a question, you're going to ensure that that question gets answered, right? You're going to resolve it. You can attest to the integrity of the research, and that any questions are appropriately investigated and stuff. So the big one that comes up for negotiation is the first one, right? Substantial contribution. What does that look like? And Derek, if you can switch to the next slide, the other part of this guideline, or the other one I want to talk about is the Good Publication Practice Guidelines that were just updated this year. And this is good publication practices, in working with the pharmaceutical industry from a sponsorship perspective. And these guidelines cover a number of different areas of how that relationship should work in terms of clarifying roles. What is publication planning? Should there be a steering committee if it's a large clinical trial? They also touch on ethical principles, plagiarism, duplicate publishing, some of the items that are also covered in ICMJE as well. But when they get down to authorship, they look at the ICMJE criteria as the foundation for this. But they've also recently developed an authorship algorithm, right, to say what does substantial contribution to the work look like. And it's kind of a checklist to say these criteria would meet it, and then these would not. For example, just coordinating the study or managing the budget for the study, pulling all the pieces together doesn't warrant authorship. Although the study couldn't happen without this person's contribution, right? But that person will not have kind of intellectual contribution to the analysis and interpretation of the data. Important to getting the study done, but not so much for the intellectual contribution of the study. So that's an interesting new development as well, because it was always that question: the ICMJE does not specifically define what's substantial contribution, right? So it's relative among the stakeholders within that group. And the other part I wanted to mention on this is from GPP. They looked at other reporting standards, right, and how they apply to the different kinds of research. There's a website out there called the Equator Network. They talk about the Consort Guidelines, which is the reporting of clinical trials. It's kind of the most recognized guidelines. And as I was talking about this with Karen and Renee, there are other guidelines out there in terms of how to report educational initiatives, and I didn't have exposure with them. Karen had heard of one of them, but when I looked into research of recent continuing medical education publications in a couple journals, I didn't see a lot of reporting towards what were referred to as the GREET guidelines or Squire EDU guidelines or or recommendations checklist in terms of how to report the data. Or another one that I came across for doctrine. So I can't speak to them. I didn't see them being used that much in practice from my research. But I think it's important they speak to how to report educational initiatives, and they may be geared more towards academic programs and academic, medical teaching institutions and stuff. But I wanted to let people know that they're out there, and they seem like they could apply to, an ongoing continuing medical education approach as well too.
Yeah, and I think if anything, for people who are new to this, it may provide a framework for them to help them structure their submission.
Right, and you may not have to follow it to the T like you would say, hey, we're starting a new medical education program in this therapeutic area or this specialty area, right? And we're going to follow these guidelines. But it does give you an area to check a list and say, yeah, well, let's make sure we're not missing this gap, right? We're not going to provide a formal checklist that we met all these criteria, but it does say, we thought about this, and if we can include it, if we have the information, we should. So they're worth checking out, just kind of a foundational structure for how you might want to report data coming from an initiative like this.
Great, useful references. Thank you.
And then on the next slide, Derek. So we spoke about, publishing's evolution, and for the most part, the manuscript in and of itself has not changed. It's still long, and we saw that in the survey results. It takes a lot of time or a lot of cost to produce one, and that might be prohibitive of some people trying to publish their data, because you're trying to do your day job and meet your other objectives, and to sit back and take that time and do a manuscript, it could take, days or weeks easily, right? If not longer, right? To write it, not to mention the review process, sharing with co-authors. It's a heavy lift. It is. Published, the journals have offered, what are now being referred to as digital enhancements, and you can find them at the better journals and do these quite well. Visual abstracts, kind of a picture summarizing the study. They might offer a podcast where the author will, walk through the results of their trial. They can do videos on websites, author presentations where they're walking through, 2, 3, 5 minutes where they're walking through their studies. And they'll be posted on the website next to the manuscript where you'll be looking and you'll kind of have the choice. Do I want to read the 10-page PDF or look at the author summary or author interview or video of the discussion? And I think that recognizes how people want to learn as well, what works best for each individual. But it also speaks to understanding how people learn, and reading 3,000 words may not be the best way to convey your message this day and age. And, within CME, if you're putting together a program, you're used to looking through you're very comfortable dealing with manuscripts and finding the information that you need out of them. And readers themselves have gotten that way too, where they've all set up their own personal strategy of how they're going to read a clinical research paper if they have to. Maybe skim the abstract, look at the tables and the figures, maybe get to the conclusion and the first paragraph of the discussion, or maybe not any of that, right? Or maybe just look at the tables or the key figures. So some of these digital enhancements help condense the study into a format that might be, better, adapted by certain readers and embraced. Other thing that's happening in the publishing world, they're having journal families where a certain keystone title that's been around for decades or 100 of years may now have subspecialty type journals. Lancet has a number of them. JAMA has introduced a number of them, right? So you submit to the main journal, you don't get accepted, but they'll say, hey, we didn't accept it, but our subspecialty journal in oncology or endocrinology may want it, and we're just going to kick it over to that, which does make the peer review process a little bit more efficient. But it does, in terms of you don't have to reformat it to go to another journal, you got another shot at a journal from a reputable, family of publishers. But it is part of a new business model as well. What that means is there are more choices, there are more journals to read, and it still speaks to, it's still, tied. All of these digital enhancements are still tied to basically a long manuscript, right, as the foundational communication, and then these are kind of an add-on. From where I sat on the publishing, the medical publishing side, these add-ons were an extra few $1,000s and a couple more weeks on the development timeline, which kind of, went counter to my goal to communicate information faster. Karen mentioned open access becoming more common and as a process. And I also want to just point out preprints as well, right, which do address help address the how do we get information out there faster. Which preprints do. So someone writes a manuscript, they go to one of the preprint servers, and there's many of them out there, but they're not peer reviewed. There's still a long manuscript. And, there's been some high profile retractions or discussions of data that have gone out as preprints. They've gotten a lot of feedback. Within COVID, there were a couple of very high profile ones where people were saying something and ended up being retracted from that, and then, reanalyzed and fixed through kind of an open peer review process as well. But preprints are out there. They're becoming more common, certainly within the pharmaceutical industry. However, they've not really been adopted because they're not peer reviewed. Right. So, that's a key consideration in the pharmaceutical industry, that it's peer reviewed data. So, so the next slide, Derek. So with these enhancements, there are some things that haven't changed. They're still the same old. Like I said, it's still a long form text manuscript that takes a long time to write, and it can be very expensive to produce. There's still long peer review times. There's still high rejection rates. There's still a chase for high impact factor journals, and then there's still always a review or two that you get back from peer review comments where the comments might just be off target a little bit. So what I'm hoping to accomplish with the research post is it's a peer-reviewed publishing channel, a visual presentation format. For now, it's just kind of a slide format. The platform itself can handle video and visual format as well. Certainly rapid publication, and under the concept that once someone completes a study, whether it's clinical research or in this case, analysis of an educational program and the outcomes from that, there's almost always a slide deck first, right? So I'm saying, hey, give me your 15 or so best slides. I'll get them peer reviewed, and we can get them published right now, right? Instead of having to go backwards and not, I don't mean backwards, but to put them into a format, spend a lot of time and effort and cost to put them into a manuscript format that people may not embrace, right? That may not be the best way to reach them. So that's what I'm trying to accomplish with the research, to put information, quality information into a format that people can actually use, right? Accelerate the pace, because we're going to cut out the need for a long manuscript, which, my research into this shows that most of the time people aren't reading, right? Or they're reading only parts of it. Right. Yeah. And it is a big lift, right? And, a format like this isn't for every kind of data set, but there are opportunities out there to, I just want to point out there's another opportunity out there, including the research post, to communicate certain types of data in a way that might meet, need for publishing faster and in a format that people can actually use. And I'm really just trying to match how people read and share information today, which I think ties into, how the CME efforts are going, right? How these programs are built, right? To get people to embrace the information and understand it through, a different type of format. So just giving them here, go read this paper and let me know what you learned, right? So I'm trying to be a little more active in that.
Thank you. What I love about your approach with the research post is a couple of things. I mean, number one, you really honed in on these digital enhancements that the publishing world saw. They were basically having to provide shortcut alternatives for their readers to consume the papers as well, because they were seeing the need for that. Secondly, obviously, I'm a huge fan of visual presentation of content. But what our CME audience hopefully will recognize here is that it is another channel for publishing data. It is peer reviewed, so it is going through that rigor, if you will, for acceptance. But the writing skills that CME providers would have in putting slide decks, visual stories together, etc., is more amenable. I always felt like manuscript writing is kind of a different writing style, and maybe, not easy for people to switch between the two. So hopefully, considering an option like this would truncate the time and cost and staff, and then therefore perception of publishing outcomes as a barrier for providers. So before we move on to talking about visual, I've got one question for you, Mark, that came in. And maybe the research post is the answer to this, but how do you see medical publishing world evolving even further down the road, say the next 5 to 10 years?
Yeah, that's a good question. And that's where, the research post kind of gets out there, and these digital enhancements are becoming more commonplace. They're seeing, I've seen peer-reviewed podcasts published, right? So publishers are being, innovative as well. But there's still the old school mechanism, the old school thinking around, let's go for the highest impact factor journal. We don't care how long it takes, or how long it costs. So I think that the publishing industry is getting there, but it has been a very slow shift, right? And as I said, everything they're trying to do is still like an add-on, right? And it's kind of the next step. And to get to that next step, there's still that very long lag time with the manuscript, right? So will journals get there where they're doing, brief communications or letters or, everything by video and stuff, but communication is changing. How everything, it affects every, part of our day, how we get our sports news, how we get our news and everything like that. And, social media and stuff. So peer review, I think, will stay. I saw a quote where someone said, I don't think preprints are going to replace the medical journal or the academic journal. But he did say there, the opportunity is for another channel that meets the needs of today. So whatever the needs might be in 5 or 10 years. And if we look at, I think the number is over 3 million new medical journal articles get published every year. There's 30-some thousand journals. And I just introduced another one, but, or another channel, right? Not a journal per se, but another channel for that. So there's a lot of information out there. And I think the field will just have to shift and say, how do we make sure that people are reading our data? And,
Mhm.
And the journals like JAMA, New England Journal, and and they'll be at the they'll be at the front of it. BMJ Lancet. I mean, they're already doing great work in terms of the digital enhancements as well too.
Yeah, it's been there. And I think the critical thing is that peer review is still in place. So the credibility, the integrity of the trust factor is untouched. So thanks, Mark. And let's switch gears a little bit now to thinking about, if you're going to present data in this way, what do we need to be considering? So before we hear from Renee, Derek, I think we did have another poll question for our audience. So do you consider visual design principles when planning to share your data, whether that's your needs assessments or your outcomes, or if you're a supporter, the totality of your program? The options we provided here is, pretty much yes, we have designers on staff who will work on this. So you have design resources, sort of. We've got decent enough PowerPoint skills. Or no, we don't have time or staff dedicated to this, that it just kind of gets done. So about 50, or so 2/3, 60%, it looks like we're settling on there. Have designers on staff. So that's great to hear that people are putting some design effort around presenting their work. So Renee, just jumping over to you in the next 20 minutes or so, if you can walk us through some design principles that we can all consider in order to make our data presentations more compelling.
Sure. Thanks, Karen. And thanks, Mark, for kind of leading into what I'm about to talk to you about. So, yeah, I'm here to kind of convince you why visualization might be a good thing to consider when you're thinking about presenting data or sharing knowledge. One of the things I think it's really interesting listening to this conversation, as I'm coming from a more visual communication side. I certainly have worked with with people publishing medical publications on small visualizations and such. But I just wanted to kind of start off with, next slide, please, Derek. Showing you this map. And I think one of the reasons to think really about visualization, and data visualization is my area of specialty, is that it can reveal. And this is actually quite an older example, showing a map of 19th century London. And this was a map that was used by public health representative John Snow to visualize where clusters of cholera cases were occurring in London. And you can see where the red circle just popped up, a stack of blocks in this one area, which is literally just taking kind of a map and visualizing on top of it where the cases are occurring. This simple method, this map, was able to reveal exactly what the problem was. There was a contaminated pump located at the intersection of Broad and Cambridge Street. So, so this is one principle I think that is worth keeping in mind as we think about how to share data and information looking forward. Next slide. So another thing I can't ignore is, that most of us today are kind of overloaded with stuff, overloaded with information, overloaded with data, overloaded with visuals. There's a lot out there. So I think one of the things that just really considering visual design as you present your information is to kind of reduce or find ways to kind of push through that overload. So thinking about simplicity, thinking about how we can organize information in a way that is going to, best communicate whatever it is we're trying to communicate. The visual here is actually a compilation of data from one of my MS in health communication design students, where she was tracking her screen usage for a week. So this was a way she quite literally visualized her stimulation through the screen, which I think is just relevant for us to keep in mind as we move forward. Next. Another thing to consider is how we communicate. So, data visualization basically can serve the same goals as writing can to communicate. I know, we're having a discussion here about publishing. There are other ways to communicate besides writing and words, and data visualization can often meet the same goals that writing can meet, which is, to record, to understand, and to, really emphasize communication and understanding. I know that's what you all are trying to do in, this publishing industry. So this example here is actually a data visualization that quite literally came from someone's written record of their cancer experience. So various colors are indicative of what type of day they were having, what kind of tests they were having. It was, all through a period this person was going through different chemo treatments and other doctor's visits and just life stuff as well. So yeah, data visualized can communicate certain things we just would not see or experience in the same way we would with writing. Next. Okay, so understandability, another goal of, a publication is to create understanding. So, visual displays like this one displayed here, which is actually a map of the London Underground, display things that in a way that's much easier and faster, to Mark's point of, finding ways to get this information out faster and easier to people. Without this map, we would need, to describe these 270 stops, we would need 72,630 individual explanations just to explain how to, navigate this system. So I think this is a very, kind of relevant example to exactly how sometimes, visualization in a very well organized way can, save a lot of time and maybe make it a lot easier. You can carry it around in your pocket and look at it just like this map is intended to do. Next. Another thing I know we're trying to do when we communicate health information is show insights. And I think it's, really relevant here that, visual displays can reveal relationships and trends that might be difficult to see when the subject matter is explained only with words. So here in this display, this cartogram is displaying disparities in COVID-19 vaccinations by state. So by kind of reducing each state into this series of bar graphs, it makes it very easy to compare. So it matters a lot what you're trying to communicate, how you visualize it, and how that information is read. So that's why I'm really pleased to hear that so many people have designers on staff that are working on these things, because a lot of it is just figuring out, okay, what is the most effective way of communicating this information. Next. Oh, back. Thank you. Another tool. Okay, so in this world where we're into it, we have just an overload of imagery and information all around us. Sometimes, information design or visual displays can be useful in grabbing attention to something that is important to pay attention to. I think, well-crafted displays can capture an audience in any, field. I think it's important to consider, capturing your audience and making a display that is going to connect with them on some kind of human level, in addition to communicating, your main findings or research. Next. And functionality. I know in the medical field, we use diagrams a lot to explain function and how something works or show a process. So here's two diagrams shown here. One is kind of our typical display of a diagram of a heart, which has little arrows in it that is trying to show us how things work, how blood and oxygen move through the heart. But it's obstructed. A lot of the connections and functionality are actually obstructed because there's so much detail in this diagram. If we look at the one on the right, which is abstracted to look just like, which is actually designed to look more like a subway map, we immediately can connect to the visual symbolism and semantics that we know mean, directional things flowing, and we can move through without being distracted by other things. So functionality is a very important part of all of this. Next. And lastly, I just wanted to say memorability. This quote, "To remember simplified pictures is better than to forget accurate numbers," I think is very just, at the moment right now where we are. This visualization, which many of you may have seen, it was New York Times ran several of them back in, during the Iraq War, I believe, just to show the amount of people who were soldiers dying in the Iraq War. So, again, the visual of seeing the actual quantity of the number is more, I think, memorable than perhaps just seeing the number printed in words. Next. So that's it. These are two sources that I referenced throughout the this little presentation. And next. And lastly, just a little plug, just to kind of put it out there. This is the program that I mentioned that I teach in, the MS in Health Communication Design, and it is a low residency program that offers certificates in different kinds of design and communication around health. So definitely, if you are interested, check it out. Thank you.
Thank you, Renee. So while you were speaking there, we did have a question come in. Somebody commented that a lot of adults spend a lot of their work life communicating in words, and as we've learned, they still struggle to do that effectively, to communicate effectively. What concerns are there that the same professionals can effectively communicate in visuals and infographics?
Sure. I mean, I think obviously to communicate with graphics and visuals, you have to have someone who has a knowledge of, principles in visual communication, just general principles. I mean, there's a lot. I think what's happening today, and why some people are feeling like, so overloaded with information and visuals is like, we don't often get experts in design and visual communication working with experts in health communication. And I think it's really, really important to really always be mindful of that, because you can make a terrible visualization that will communicate something that is not what you want to communicate that could, just like with words. So yeah, absolutely. I think it's key that designers and people who are experts in visual communication are, involved in that part of the process.
And it looks like you are doing your part in educating a whole new cohort of people who will be able to help us do just that. I agree with you 100%. I think the key thing is the marriage of both, right? Is working with people, or at least having a good partnership where you can bring both elements in, maintaining the integrity of the scientific message or the understanding of that, and then the art of it in how to visualize that in a good way. The other thing I love about your program is that it's open to students with and without previous design experience. So, we are professionals working in lifelong learning. If anybody watching this program is interested in furthering their own professional development, sounds like you don't have to be a graphic designer to think about this program. So definitely check it out. And Mark, one of the things I wanted to kind of close out with you is, I assume you would be interested in talking to CME providers about submissions on outcomes data for the research post as an alternative to other journals.
Yeah, I think we learned from the poll question that there are barriers to publishing, right? And some of that's time, some of it's cost, some of it's skills. And not that the research post or a platform like mine can fix all of those things, but one of our goals is to open up opportunities for other people to publish important data. We want to democratize health, medical research in terms of making it available to everybody, open access, right? Patients and caregivers as well as providers, but also to look at some of the other data sets that are going out there. I'm trying to obtain submissions in the digital health world of people with an application. There's an app to manage their care, right? And that data would traditionally be very hard to publish in a traditional medical journal because they're looking for something more hardcore science. But it's that kind of information that might inform a patient to say, hey, there's other people out there like me, right? They saw multiple doctors before they got the right diagnosis. They have the same kind of symptoms. In the morning they feel like this, in the evening they feel like that, this or worse. So it's those kind of non-traditional, non-clinical research, studies that are out there. That's good data that informs, patient care, helps educate doctors, and that's kind of the thing I think will come out of the CME opportunities as well in terms of, what are the outcomes of some of these programs in terms of just that, hey, we learned something about a new medication, but how are we going to apply that to clinical practice? And I think making that jump from the methodology of how the program worked from an educational perspective to how does that apply to clinical, to a clinical practice and a clinical need to, ultimately help patients, which I think is a shared goal, among all of us. How do we communicate to help patients? That's something that I'm interested in, that I recognize from my experience would be difficult to publish traditionally, but that patient journey story, is informative, right? And we are all patients ourselves or caregivers of, in some regard. And that's kind of there are other opportunities, the other aspect of opening opportunities to publish beyond a phase 3 clinical trial of a new cancer drug. There's a lot of new healthcare data out there, and I want to try and help communicate that.
That's great. And Renee, I know from your work to date in the healthcare space, you've been working on things that span both the healthcare professional and the patient realm as well. And the visual approach there is great because it speaks, it's I think it's particularly useful in a lay audience.
Absolutely. Yeah. I think one of the things that I kind of think about a lot is, or just have thought about a lot in terms of like medical communication, is it often is speaking, we're often speaking, medical professionals are often speaking to other medical professionals. So if you are trying to communicate to, the general public or a lay person, really thinking about more, what is this just like the way that, everyone else writes it and says it, or visualizes it? Is that why I'm choosing this way to present it? Or is there a way that would actually communicate it more directly, more, in a way that's more easy to understand? Yeah.
Mm-hmm. Yeah. And Derek, just as we're wrapping up there, because I know Derek has been inherently involved in COVID education, but I think one of the things the pandemic did bring to us was challenge people to get information out faster, get information out in a way that people could understand so that they could make decisions quickly. And I saw a lot of really compelling use of visualizations throughout that process. So definitely served its role there. So thank you both very much, new presenters to CME Palooza, to the CME audience. Thank you so much for participating with me. And thank you to Derek for having us.
Sure, yeah, and thanks, Karen, for leading it. And that's exactly what I was going to say. Thank you both, Mark and Renee, for popping on. It's always great to have people from outside of the industry coming in and sharing their perspective. So this was super valuable. So thank you both.
Yeah, happy to be included. Thanks for having us. Yeah.
Excellent. Few wrap-up slides before we move on. Just as a reminder, if you have a moment to take our survey, it's right on the live page of the website where you may be right now. There's a link down below. Take our survey. Very helpful for us as we're planning the next iteration of CME Palooza. So we do appreciate your feedback. There is still ongoing the CME Palooza scavenger hunt. BroadcastBeatStudio.com is our sponsor. Click on their link. And you can find our CME Palooza logo somewhere on there. There are prizes involved if that is any motivation to participate. And then lastly, to view the next session, which will be Social Media CME Shiny Object or Real Deal. Have your questions answered. Coming up at 2 o'clock. As a reminder, this session will be available as soon as we end it. You can find it on our agenda page of the website. And then all of the sessions from the day are available there as soon as they're over. And then they'll be added onto our archive. Big thank you to Array for sponsoring our archive this year. And with that, that is everything from us. Stay tuned for the next session. And I will see everyone at 3 p.m. today for my last session of the day. So thank you, Karen. Thank you, Mark. Thank you, Renee. Really appreciate it. And we will see all of you soon.
Thank you.